So in the previous video, we spoke about migraines and headaches and what causes it and what you can do to alleviate it. In this video, we're going to speak about muscle releases and how exactly you can release these muscles. So the first muscle that's been released is called the Masseter. These are the muscles within the jaw that particularly help with clenching. So what you want to do, you want to take your fists, particularly your knuckles, and you want to place it just below the level of the ear towards the inside, and you want to pull all the way down towards the chin bone or the cheekbone, and you want to pull all the way down. Now you want to do that a couple of times, about 10 strokes going down, and you want to give as much pressure as you feel comfortable. You don't want to push too hard, but you also don't want to push too little. So that's the first one. We're going to do that about 10 times, and this feels really good as you do so. That's the first one. So the second one, we want to release the temporalis, which is a muscle that attaches on the outer part by the temporal bone, going in the fan shaped position around the ear. So what you want to do, same thing, you want to take your hands, place it on the sides of the temples, and you want to push it all the way back behind the ears. Start on the side of the head, good pressure, and push all the way back. Make sure that it is firm pressure. Wherever you feel the tension, I want you to hold on that area for about 5 to 10 seconds and then go to the next area. You want to do that again 5 to 10 times, okay? The big thing is hold, sustain pressure on that particular area that you feel is tense, okay? That's the big thing. The next one will be the SEM, which is your Sternocleidomastoid. So if I look to the side, this muscle right over here attaches to the mastoid process, as well as the clavicle and sternum. This muscle you want to release as well. So what you want to do, you want to take your thumb and you want to drag it all the way down along the muscle, and you want to keep doing that. If that doesn't feel comfortable, what I want you to do, you want to hold sustained pressure, and I just want you to look all the way down and look all the way up. Look all the way down and look all the way up. Look all the way down and look all the way up as you go in a downward motion. Notice that my head remains in this rotation position, and you'll do both sides, okay? Same thing, apply pressure and look up and look down. Look up and look down. Again, firm pressure. That is quite important. For the next one, we're going to release what's called the Lateral Terragoid. And for this, I'm going to get my glove. So you grab your glove, and now we're going to release the Lateral Terragoid. So if you're going to release the one on your left hand side, you'll use your right hand. The pterygoid muscle is located just in the jaw itself, next to the actual teeth itself. So you want to make sure that you place the pad on the inside of your cheek direction. That's very important. You're going to place your finger inside. You're going to find the tender spot going all the way back, as far back as you can against your molars, and you're going to find a particular spot there that's quite tender. You hold it for about 5 to 10 seconds. You then change the angulation. Hold for 5 to 10 seconds until you've touched or covered the whole area, and then you can change to the other side. It is very difficult to explain how to release it, so I'll rather just show you. So place your finger into the mouth on the outside of the teeth itself. You'll find a tender area. You close the jaw slightly and you apply pressure. And change the angulation. It is quite uncomfortable, it is quite painful, but then you'll change over to the other side. So that's it. This is how you release the 4 major muscles and contributing to jaw pain, which will then cause your migraines and headaches. Give it a go. Let me know your thoughts and tell me how you feel.